Good evening, ladies and gentlemen. On behalf of Dr. Mohan's group of diabetes institutions, we extend a very warm welcome to all of you present here for the launch of Dr. Mohan's Digital Diabetes Revolution. Guiding you through this function is Pradeepa. It's my pleasant privilege to invite all the dignitaries onto the dais. Dr. V. Mohan, Chairman, Dr. Mohan's group of diabetes institutions. Dr. Ranjit Krishnan, Vice Chairman, Dr. Mohan's Diabetes Specialty Center, and Dr. R. Manjana, Managing Director, Dr. Mohan's Diabetes Specialty Center. Thank you. As per the Indian tradition, we begin this auspicious occasion invoking the blessings of Almighty. May I request Dr. R. Jayashree, HOD and AGM Clinical Laboratories, to kindly invoke the blessing. Hamsavagini Sharade Veena Vinodini Sharade Hamsavagini Sharade Pavaraga Vinodini Layatala Bodhini Sharade Vedavagini Shubhapadayini Vidyadayini Sharade Jayati Jayati Brahma Swarupini Jayati Jayati Moksha Pradayini Jayati Jayati Veda Vilasini Jayati Jayati Ma Hamsavagini Sharade Veena Vinodini Sharade Hamsavagini Sharade. Thank you, Dr. Jayashree. I now invite Dr. V. Mohan to deliver the welcome address.
Good evening, ladies and gentlemen, the press and media, those of you who are in the auditorium, as well as those of you who are attending through Zoom from very far off places. I heard that people even from Delhi and other cities are also online. Let me wish you all a very happy Vijayadashmi. It's been a season of festivals, one of the most important festivals in this country. And Vijayadashmi is the auspicious start for anything new that you do. And therefore, I think it's very appropriate that on Vijayadashmi Day, we're launching something which is very special. Diabetes treatment is undergoing a sea change. So gone are the days when we had to get some blood sugars and then see the patient and then offer the treatment. While that is still very much an integral part of the treatment and the examination of the patient, checking for complications, all that what we do physically is very, very important. COVID actually brought a big change in the way we manage diabetes. In fact, if I can share an incident with you, you know that COVID started sometime in March 2020. In February 2020, a group of 10 or 15 world experts from all over the world in diabetes met in Spain, in Madrid. And I was representing India. And the idea was to conceive how a virtual diabetic clinic would look like. We had a lot of difficulty because none of us had actually practiced a virtual diabetic clinic. Nobody had seen, it was all imagination. And we were sitting and saying, okay, the doctor will sit in the clinic and patient will sit at home and some blood, how do we talk? Maybe it's phone, maybe it is through WhatsApp video or WhatsApp call, or maybe through internet, something will be sent, through email, something will be sent. We're imagining all kinds of things at that time. And we prepared a draft of that paper, which is to be published in the most prestigious diabetes journal called Diabetes Care later that year. Little did we realize that 4 weeks from there, COVID will hit us. In fact, COVID had already started in Spain. I didn't even know. I was walking about without mask, without anything. Nobody knew about COVID. This is 2020 February. And within 2 months, lockdowns came and we were forced to innovate and to start, because people are not going to come to the clinic. And so they would sit at home. So we had to think of something completely different. So we started what's called as tele-diabetology. We had to quickly get our systems together and arrange for tests at home and then connect to them in some way. All this became a reality. Somewhere by September, October, the article was written and to go to diabetes care. So I felt, we were just discussing in February that all this looks like some fiction or something. And here we are already experienced it. Nobody in the world, none of those 12 people thought that we are actually going to practice it. And we said, now we can modify what you've written because you actually got experience. So I think COVID was actually a big turning point for treatment of non-communicable diseases like diabetes. Today, the world is very rapidly changing. People are even working from home, leave alone, having tests at home and so on. So with that kind of a background, what is called as digital health has evolved, which means that you don't have face-to-face. You can do everything digitally, you can do everything online. And that is what the Dr. Mohan's digital diabetes, we call it as a revolution, because I think we are starting something which is very new, something which is going to be earth-shattering. And that's why I said it's very appropriate to inaugurate it on Vijayadashmi Day, because I think this is the day when all new auspicious starts occur to your thinking, to the way you perform your duties. We've just finished Ayudha Puja, so we've rested all the equipment, and now they have all been energized. So no better day than today to start what we call as the Dr. Mohan's digital diabetes revolution. Look at this, the yellow thing there. There are 3 Ds already in that. Okay, so the D for Dr. Mohan's and the digital and the diabetes. So this 3D you're going to hear quite a bit today as we go on in this function. This 3D is going to come back again and again. And what these 3Ds are, I'm not going to tell you now, because we have 3Ds as a surprise for you. But today, I think without an app, we don't do anything, isn't it? If you want to check a hotel, you go there and you use an app and you find out what it is. You're Googling something and you're finding out everything. Just now, one of my foreign friends who's going to visit us in December wanted to know about all the beach resorts in Chennai when they come in the end of this month. Immediately, we are able to get all the information online and we are sharing it with them, saying that these are all the resorts, these are all the rates, and this is what it is. Everything is a virtual world today. We even sent them videos of each of those and said, you have a look at it virtually, and then you see which one you want, and then we'll do that. So the whole world going that way, whether it is booking your tickets, airline tickets, hotels, appointments, everything, treatment, laboratory tests, everything is done online. Even reporting is done online to an extent that the CT scans and MRIs done in US, guess where it's being read? In Chennai and Bangalore. Okay, they take the CT scans, send it here. It's night for them. It's daytime for us. By the time they wake up next morning, all the results are gone. First class quality, all red. Even the FDA approves it. So this is how even borders of countries have all broken down now due to this digital revolution which is taking place. Now, if somebody is having a heart attack, you're going to chest pain, heart attack. You can't say, wait, I'll digitally treat you and so on. So you can't do that. It's an emergency. Somebody has a fracture, you have to admit them. You're COVID, you're in ICU, you cannot do digital. Even there, a lot of digital thing came, by the way. CTs were done and then sent digitally, and then the radiologist will tell you the score and whether it needs to ICU admission. All that is being done. But in a chronic non-communicable disease like diabetes, a lot can be done digitally. A lot can be done using various platforms. And to tell you about all that, we will have the next speaker who will tell you what is special about this. We have been a little slow in coming into this. The reason is we wanted to come with a bang. Everybody is offering small things here and so on. But we said, no, we'll wait until we have perfected everything, until we have a solution for everyone. Okay. And that's what we are offering here today. So I won't hold up the suspense anymore to you. I'd just like to welcome all of you for this press conference. We've not had a press conference for a long time. Thank you for coming in spite of being a holiday. And this message must actually reach a lot of people, because people must make use of whatever. It's taken us months, if not years, to create what we've created today. And therefore, it is my fervent wish and the wish of the management and our institution that millions of people are benefited through what we call as the 3D revolution, or the Dr. Mohan's digital diabetes revolution. Thank you.
Thank you, sir. Let me now request Dr. R.M. Anjana to provide the audience some insights about the Dr. Mohan's digital diabetes revolution.
Good evening, everyone, and thank you for being here. It's my very, very pleasant privilege to tell you about the 3D diabetes revolution here at Dr. Mohan. So when we talk about diabetes management, okay, hypertension or obesity, so many apps are there. Yes or no? All of you have some app or the other you've used for step count, for health, food, something, prevention. So many apps are there. So you may be thinking, what is new? Why are they calling it the digital diabetes revolution? Just innor app. This is not just another app. This is an entire healthcare revolution that we are talking about. So now, which is the one, Hari, I'm supposed to be pressing? Hari? That's not working. Yeah, the question we're asking is, how can digital transformation help to deliver quality diabetes care? So you know about video consultation, audio consultation, but how can we put all of this together, not just addressing one particular thing, but the whole 360 of diabetes care? Now, at the center of the diabetes care is the patient, correct? பேஷண்ட்டுக்கு வந்து நிறைய கேள்விகள் இருக்கலாம், பேஷண்ட்டுக்கு அட்டெண்டர்ஸ் இருக்கலாம், ஜெனரல் பப்ளிக்கு இன்ஃபர்மேஷன் வேணும்னு தெரிஞ்சுக்கலாம். அதெல்லாம் வந்துதான் ஃபர்ஸ்ட் ஸ்டெப், அவேர்னஸ், நாலேஜ். That is one step in diabetes management. Yes. அப்புறம் அந்த நாலேஜ் வச்சு நம்ம ஆக்ஷன் பண்ணணும். நம்ம மாத்திரைகள் எடுக்கணும், வாக்கிங் பண்ணணும், டயட் பண்ணணும். அது நெக்ஸ்ட் ஸ்டெப். ஓகே. தேர்ட் ஸ்டெப் இஸ் யுவர் டாக்டர். டாக்டரோட நாலேஜ் இருக்கணும், அப்டேட் இருக்கணும், அவங்களுக்கு லேட்டஸ்ட் தெரப்பி தெரியணும், டெக்னாலஜி தெரியணும். இது எல்லாமே கவர் பண்றதுதான் டிஜிட்டல் டயபிட்டிஸ் ரெவல்யூஷன். அதை பத்தி தான் நம்ம இப்போ பேச போறோம். நெக்ஸ்ட். So, introducing the 3 Ds for diabetes healthcare. Hi. The first D, and I request Dr. Mohan and Dr. Ranjit to unveil, put on the lights, please. The first D, introducing to you, ladies and gentlemen, Priya. Working? So our first D, as I told you, is called DIA. DIA stands for light. DIA is a short form for diabetes. But DIA, say hi everyone to DIA. Okay, she is a AI-based health assistant chatbot. Okay, so she is an automated chatbot that gives you information on diabetes. Remember, we said information was an important step in diabetes care. What does she give you information on? Anything. She'll give you on diet, physical activity, stress, obesity, sleep, prevention, whatever you want. You ask a question and she gives you an answer. So she is a chatbot Her things are, you can have frequently asked questions, diabetes related information. She is able to give you. She also helps you to purchase medicines online, locate facilities and clinics, chat with a live agent. So suppose she gets stuck, you ask her a question she doesn't know the answer to, or you want to talk to a live agent, that is also possible. If there is an emergency, she's immediately able to connect you with a doctor. Dr. Mohans has a 24-hour helpline where doctors are available for any diabetes related emergencies. We also have supplies and devices and book appointments. So basically, she is an information chat bot that you can talk to get information related to diabetes. Okay, so that is our first D. So she is a WhatsApp-based technical staff. The platform service provider is Yellow Messenger. They are the ones who developed this. How do you connect with Dia? She's available on WhatsApp. So all the chatting happens in WhatsApp. But she's also found on the Dr. Mohan's website, Facebook, Google My Business, etc. So this is the WhatsApp number. So if you go around Dr. Mohan's itself, you'll see a QR code can be scanned, or this number, you can say hi, and in the mother, it will open up like this if you want to talk to Dia. This is the website. So either it can say chat, or you see the icon is available anywhere on the website. You go and click, a chat will open up with Dia. This is Google My Business. Again, you will see chat there or the icon, and it opens up a chat to answer questions that you want. And this is, of course, Facebook, where you can, anywhere you go and click on the icon, anything related to diabetes related information will be available through the Dia bot. So this is what it looks like. The categories of what she will discuss are all available there. So you can ask her anything, she will provide. If suppose you want an appointment, they'll ask, is it a new patient, etc., etc. It goes on like that. The conversations are quite intelligent. You can ask her a question, and it's very interesting to see how she replies, how she thinks and replies, right? She's a bot. She doesn't have a brain, but she has artificial intelligence. So it's quite nice to see how she manages your questions and answers to them. And in case of emergency here also, immediately there is a callback service. Immediate doctor is also available. So that, ladies and gentlemen, is the first D or DIA, which is an diabetes information chatbot. Now we move on to the second D. Ladies and gentlemen, introducing Diala. Okay, so that is Diala. You notice that Dia was a doctor image. Now Diala is a nurse. And why is that? Because, well, in a doctor's consultation room, you spend 5 minutes. You get a lot of information, you get a prescription, you spend 5 minutes. But ultimately, if you get admitted in a hospital, who is looking after you? The nurse, right? She spends a lot of time with you, and thus the nurse is actually more important. Diala stands for Diabetes Lifestyle Assistant Mobile App. So she's an app, okay? She's an app. And what can she do? She stores all of your personal information and your medical information. So that's what she does. So suppose you have something like a weight, step count, what you're eating, what you're doing, what is your BMI, all of your personal information, your blood pressure, your vitals is stored in Dial. And that's not something that's new. People have done that. But what makes this really special is that it's integrated with the hospital records. So all your reports, all your prescriptions, everything that is advised in the hospital, diet advice, everything that has gone is integrated with the app. And the app then tries and helps you to reach of your goals. So suppose you're monitoring your blood glucose, you get a value. You can then put this onto Diala, your doctor sees it immediately. all your lab reports. You don't need paper anymore. It's all coming onto the app. Everything is, there are trends. Are you doing better? Is sugar going up? Is cholesterol coming down? What is moving in which direction? And this again is a direct link with your doctor so that they're able to see. So you have your own daily health tracker, and this will be based on what is advised at the hospital. Prescriptions, all your prescriptions are available. So automatically you can go and buy your new medicines and things, making everything online. You can book appointments. There's a diabetes Shopee, of course, all diabetes related products can be purchased. Health records, this is what I said. So all of your health information, your records, everything is available with you on your phone. So in any case of any emergency or anything like that, it's just all on your phone. Your lab results are available. Your glucose monitoring, your glucose, everything is available on Diala app. Of course, there are notifications and things also that she'll send. So what does Diala do for you? Diala helps you to reach your target A1C of 7%. Okay, so this at the moment is not AI based, but it is getting there. In version 2. There will be AI based programs also coming into Diala. Today, she is just an app that is helping with all of your records and personal information. So she is an app plus a clinical staff, and she is available on Android phones. You can download her from Google Play Store. So if you go to Google Play Store, this is downloadable. And these are the steps. This is what the screenshots look like. So this is Diala app for you. So you can pick an actionable item. And every day, this is a very patient-friendly app. So every day it keeps talking to you and you can update it. And in between, so what does she actually do? You see the doctor once in 3 months or 6 months or whenever you are seeing the doctor. But that in-between time is very important, right? There may be a wedding one day. You may come to Dr. Mohans and be given a sweet that you should not be eating, right? So in between days, it is Diala who will help you to reach your glycemic goals, your blood pressure goals, your cholesterol goals, and all of these things the app will help you with. So this is what it looks like. Patients can choose an appointment. Look at these. So this is the glucose value being entered, vitals, BMI, the calorie indicator. So it's telling you how much of your goal, protein, fat, carbohydrates. So remember, at Dr. Mohans, we're powered with Asia's largest database on foods. So we have that in-house that was developed after 7 years of research. So for every food item that you put in, it is telling you what calorie, carbohydrate, etc., you are consuming, and that is available on your app. So it is telling you whether you are in red zone, green zone, and things like that. Dates, things, all of these are available. So this is how your vitals look. See, the vadai, so you can put in each of these, what you're eating, etc. In the next stage, we will be putting pictorial representation, which means you can take photo of your plate and put, and Dia will say, today it doesn't do that. Version 2 will do that. Okay, today you have to enter. So these are all the physical activity reports. These are the medicines. So your prescriptions look like this. It will be available for you. You can choose, order, not order, your choice, whatever you want to do. Right. So I finished Dia, I finished Diala. And our last app for today, ladies and gentlemen, introducing Diana. Okay, so we're now here with Diana. So that's Diana for you. What does she look like? She looks like a physician's assistant. Okay, so we have a doctor, we have a nurse, and we have a physician's assistant. So, what does that mean? So she is something which is called a precision diabetes tool. Okay, so she stands for Diabetes Novel Subgroup Assessment. Doesn't matter what she stands for. What she does is as follows. Now, everybody with type 2 diabetes, everybody knows type 2 diabetes, right? It's a common type of diabetes that is present. Everybody with type 2, new onset type 2 diabetes, as of today, are given the same medicines for everybody. Okay, but the same medicines cannot be given for everybody. Somebody who's young is different from somebody who's old. Somebody who's thin is different for somebody who is little overweight, right? So the medicine, the treatment, the risk of getting eye disease, kidney disease is different for every person. So how do we know? Today, we are not treating precision-based, person-based. We are not treating like that. We are just generally treating according to guidelines. Okay, so Diana app for the first time is making us able to give individual precision-based treatment for our patients. So Diana is a doctor's assistant. What does she do? She's a web-based advanced machine learning tool. And she helps us doctors at Dr. Mohans to classify diabetes based on your risk. So patient walks in the morning, they're giving blood, they're doing sugar, BP, this, that, all that is happening in the morning. By the time the patient reaches the doctor's room, the Diana tool has been activated, all the results have been integrated, and she is able to calculate your individual risk for eye disease, kidney disease, your personal risk of developing all this in the next 5 years. She's able to do that. So she's a risk calculator tool. These are the variables. These are commonly done at Dr. Mohans, all of these. So she uses this and she is able to tell you, she's able to tell the doctor which subtype of diabetes this patient has. And based on this, this is how she does it. Okay, so where is the video? Yeah. So these are self-population. They're entering there. So patient name, duration of diabetes, A1C. Any patient who walks into a diabetic clinic, these are common: blood pressure, sugar, all these values. Anyway, you will do the test. Automatically, it integrates, it calculates, and it tells you which subtype of diabetes. This is for the doctor. Which subtype of diabetes my patient has. Now, this person's risk of nephropathy is 27%. And this person's risk of eye disease is 8%. So I will know, okay, in the patient, okay, every 3 months kidney test pananum. Kidney disease risk vande 70%. So every 3 months nama paakano. Next 5 years na progress ahama paatukano. Eye disease, okay, not so much for this patient. In our patient vande eye disease risk romba high. Ivangalukku vande nama seekramave screen panni prevent pananum. So ஒரு patient க்கு அவங்க status, அவங்க body condition தகுத்து we are able to predict and treat diabetes. So this is the Diana tool for you. So those are our 3 Ds. We have Dia, Diala, and Diana, and there's something for everybody. For the general public, as well as for patients, we have Dia. For patients especially, and as well, it helps to connect to the doctor, Diala. And Diana is mainly a tool for doctors and scientists that helps them to give proper treatment in the right way. So if you look at this, we have a 360 on diabetes care. So we'd like to welcome you to the new era of diabetes healthcare at Dr. Mohans. Thank you.
The questions of கேள்வி எழுதுறதா கேட்கலாம்.
The language is only English.
So it is only in English, but it is coming in all our languages. Languages are there. Actually, truthfully, it was already in certain languages, but there are errors in Google Translator now. So those are being corrected, and it will be available shortly within a month or 2 in 8 or 9 languages. Diala and Dia is also download is Diala. It's a chat. No, that will increase the weight and size and all. So this is a WhatsApp. You keep it there in your WhatsApp. That's all. Diala is downloaded.
See, for Dia, if somebody just wants information, they don't even want to take treatment from it, but they want to know what diet to take. What is Dr. Mohan talking about? Just like we do YouTube videos and we do other things, they can get the information downloaded. Your point about languages is true. We are planning initially 8-9 languages, ultimately going to about 12 languages. If we can get the translation part without errors, whole India can use it. Anywhere in India, any language, Bengali or Gujarati or all the South Indian languages will definitely. So we get patients from all over India, okay, and we get from Northeast. So to come from Dibrugarh or from Siliguri to come here is not easy. Although now we have started a branch in Siliguri also. We have a branch in Calcutta also. But let's say from Jaipur or Jodhpur or somewhere somebody wants to come. Even if they come once, diabetes checkup needs every 3 months. How are they going to connect to us every 3 months? They cannot take from Jodhpur every time 3 months come. So let us say once a year they come or once in 2 years. What is the mechanism by which they can keep in touch? Right now we have only a email. They can send us some email. The data doesn't get stored. Somebody has to manually enter. Now through the app, they'll be in touch with us all the time. Whatever information they give straight away goes into their electronic records. So it is automatically updated. And so a direct contact between visits is what Diala will do. Diana is not for the patients, it is for doctors. After we test it in our center and use it, we plan to give it to all clinics in India. They can also use it. So if any doctor, because now we know type 2 diabetes is about 90% of all the diabetes. We're treating as if it is one disease. Everybody is given metformin. If that doesn't work, something else is given. It's like a lottery ticket. That's how we've been treating. Today, we know those 4 subtypes which are shown, they're treated in 4 different ways. So we are actually the pioneers in describing those 4. Now, how does a doctor know which 4 it is? They just put in the clinical character, the app will straight away, the program will tell. So this is the basis of precision medicine. We believe that we practice precision medicine, the outcomes will be better, the control will be better, quality of life will be better. And ultimately, you're treating everybody as they should be treated, as that particular patient should be. Any other paragraphs in there?
Hello.
The reason we're talking in English because there are so many other centers from Delhi and Calcutta and other people are there on the thing that says avoiding Tamil as much as possible.
Hello, doctor. This is Ganesh.
Any other?
Yeah, online.
Oh, yeah, please.
Hello.
Yes, please ask, sir.
Okay. I just want to know if your app can interface with CGM.
Can it integrate with CGM?
Yeah, so we are definitely trying for that. And the Diala program, we are trying to integrate blood glucose monitoring, that is a glucose meter readings, CGM, other lab reports, continuous glucose monitoring, even the pump data, they're on pump, even that downloadable. Right now, they're sending everything through email. But we are directly trying to enter it into this. Even the blood sugar tests which are done, many companies now, they have online their own apps and software. So that will give graphs and all that. It will tell how the blood sugars are behaving over time. So we are trying to integrate all that, and our IT team led by Jay and Sundar, they're all working on this, and very soon we'll be able to get all that. Yeah. It's quite simple, actually. It is not very complicated. You'll be surprised how good even old people are in technology today. But then very often the children take it up. They have a lot of their son or grandson maybe in IT, and they help to do that. So if they are not able to, they have visual problem or hearing problem or other things, then the family member helps out. And this is not to be done immediately. They can take time. So this is not like a phone call where within the next 5 seconds you have to answer. And they can take their time, fill in the data, send it by the end of the day. So that is one advantage. Any other doubts? Anybody else online? Any other doubts? Okay, if there are no further questions, I'd like Ranjit, want to say something? So I'd like to thank all of you for coming. I think it's a very important day where 3 different technologies are being introduced on the same day. I'm not aware of anyone else who has done this. A lot of work had gone into this. I'd like to thank our teams who have been working so hard. And Ranjit too.
Respected dignitaries on the dais, ladies and gentlemen, gives me great pleasure to propose a vote of thanks. On behalf of management and staff of Dr. Mohan's group of diabetes institutions, I would like to express sincere gratitude to our IT team, particularly Mr. Jay and Mr. Sundar. Please come. They have been responsible for developing the Diala Mohan digital app. Sundar and Jay. Then we have Ms. Jeba and Arun from Department of Data Management for developing Diana. I would also like to thank the Yellow Messenger team for help in developing Dia. That's coordinating, Gopal, yes. So we also thank Concept RP for press coordination and the representatives of the press and media for covering this function on this auspicious day. Thanks are also due to Mr. Dharmarajan and from Sangara Visions for photography. We thank all the staff of Dr. Mohan's group of institutions who have toiled hard for the success of this function. We finally wish to thank each and everyone present here for gracing this occasion. I now kindly request you to stand up for the national anthem.
So that the concept here, transform. We'll get a picture and then we'll.
One more.
That's enough.
Request you all to please join us for high tea. Thank you.